12 worst side effects of amlodipine you should never ignore. Stop taking amlodipine immediately if you're experiencing this symptom. It could save your life. What you're about to discover will change everything you thought you knew about this common blood pressure medication. There are 12 side effects that pharmaceutical companies are required to mention, but most people never connect their symptoms to their medication. Side effect number 8 is so commonly ignored that it leads to emergency room visits for 15% of long-term users, and it could be happening to you right now without you realizing it. Amlodipine is currently the 6th most prescribed medication in America, with over 70 million prescriptions dispensed annually. That's roughly 1 in 3 adults over 40 taking this drug. While it's incredibly effective at lowering blood pressure, reducing heart attack risk by up to 64% according to major clinical trials, the latest pharmaceutical surveillance data shows that adverse reactions are reported in 1 out of every 8 users. Even more concerning, research indicates that for every reported side effect, approximately 10 cases go unreported because patients don't recognize the connection. Before we continue, let me be crystal clear. This video is not telling you to stop taking your medication. That would be dangerous and irresponsible. Some viewers might think all medications are toxic and should be avoided, while others believe that widely prescribed drugs are completely harmless. Both extremes are wrong. The goal here is education, not fear. When you understand what to look for, you can work with your healthcare provider to manage your treatment safely and effectively. In the next 10 minutes, we're going to expose the 12 most dangerous amlodipine side effects that everyone taking this medication must know about, including the one that affects 1 in 3 users but is almost never mentioned during prescription consultations. Disclaimer: this video is for educational purposes only and is not a substitute for professional medical advice. If you are unsure about your condition, please consult a healthcare professional or contact emergency services. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Peripheral edema, swelling. Peripheral edema represents the most troublesome side effect experienced by amlodipine users, affecting approximately 10 to 15% of patients taking this calcium channel blocker. This condition manifests as noticeable swelling in the ankles, feet, and lower legs, creating a puffy appearance that often becomes more pronounced throughout the day. The swelling occurs because amlodipine works by dilating blood vessels, which reduces blood pressure but simultaneously allows fluid to leak from the bloodstream into surrounding tissues. The mechanism behind this fluid retention involves the relaxation of smooth muscle cells in arterial walls, particularly in the lower extremities where gravity naturally pulls fluids downward. When blood vessels expand, the increased vascular permeability allows plasma proteins and fluid to escape into the interstitial space between cells. This creates an imbalance in the normal fluid exchange process that typically maintains proper tissue hydration levels. Women experience peripheral edema more frequently than men when taking amlodipine, with research showing a clear dose-dependent relationship. At the lowest therapeutic dose of 2.5 milligrams daily, only 1.8% of patients develop swelling. However, this percentage dramatically increases to 10.8% when the daily dose reaches 10 milligrams, demonstrating how higher concentrations of the medication amplify this unwanted effect. The swelling typically appears gradually over several days to weeks after starting treatment. Patients often notice their shoes feeling tighter or indentations remaining after removing socks or shoes. The edema is usually painless but can cause discomfort, heaviness, and difficulty with normal activities like walking or wearing regular footwear. 2. Angioedema. Angioedema represents a potentially life-threatening allergic reaction characterized by rapid swelling of deeper skin layers and mucous membranes, particularly affecting the face, lips, tongue, throat, and airways. Unlike superficial skin reactions such as hives, angioedema involves the deeper dermis and subcutaneous tissues, creating asymmetrical swelling that can develop within minutes to hours of exposure to amlodipine. This condition requires immediate medical attention due to the risk of airway obstruction and respiratory compromise. The pathophysiology of amlodipine-induced angioedema involves the release of inflammatory mediators, particularly histamine and leukotrienes, which increase vascular permeability and cause fluid accumulation in affected tissues. This process can be mediated by both allergic and non-allergic mechanisms, with some patients developing angioedema through complement activation or bradykinin-mediated pathways. The swelling typically appears asymmetrically and feels firm or woody to the touch, distinguishing it from other forms of facial swelling. Angioedema usually starts with tingling or burning, followed by rapid swelling, often in the lips, eyelids, or tongue. Swelling can spread to the throat and airway, causing trouble speaking, swallowing, or breathing, potentially a medical emergency. Angioedema is dangerous due to its unpredictability, even after long-term amlodipine use. Mild cases may resolve in 24 to 72 hours, but airway involvement needs urgent treatment with antihistamines, steroids, and possibly epinephrine. Intubation may be required, making early detection vital. 3. Hepatotoxicity, liver damage. Although rare, amlodipine-induced hepatotoxicity represents a potentially life-threatening complication that can develop rapidly after treatment initiation. Cases have been documented where patients developed significantly elevated liver enzymes, including alanine aminotransferase, ALT, and aspartate aminotransferase, AST, within days to weeks of starting therapy. These enzymes are markers of liver cell damage, and their elevation indicates hepatic injury. One documented case involved a patient who developed severe hepatotoxicity after just 1 week of amlodipine use. The patient presented with fatigue, nausea, abdominal pain, and jaundice, a yellowing of the skin and eyes caused by elevated bilirubin levels. Laboratory tests revealed liver enzyme levels more than 10 times the upper limit of normal, indicating significant hepatic damage. The mechanism of amlodipine-induced liver injury is believed to involve drug metabolism and the formation of reactive metabolites that can damage liver cells. The liver damage can progress rapidly, potentially leading to acute liver failure requiring emergency medical intervention. Some patients may require hospitalization for monitoring and supportive care. Most cases of amlodipine hepatotoxicity resolve upon immediate discontinuation of the medication, but recovery can take weeks to months. The liver damage may be severe enough to cause lasting impairment in some cases. Patients should be monitored for signs of liver dysfunction, including fatigue, nausea, abdominal pain, dark urine, and yellowing of the skin or eyes. 4. Peripheral neuropathy. Peripheral neuropathy caused by amlodipine involves damage to the peripheral nervous system, resulting in debilitating sensory and motor symptoms. This condition affects the nerves outside the brain and spinal cord, particularly those in the hands, feet, and legs. Patients typically experience numbness, tingling sensations, and burning pain that can significantly impact daily activities and quality of life. The neuropathy often begins with subtle symptoms such as pins and needle sensations in the fingertips or toes. As the condition progresses, patients may develop reduced touch perception, making it difficult to perform fine motor tasks like buttoning clothes or handling small objects. The burning pain can be particularly distressing, often described as feeling like the affected areas are on fire or being stabbed with needles. In severe cases, the neuropathy can cause muscle weakness and balance problems, increasing the risk of falls and injuries. Patients may experience difficulty walking, especially in the dark or on uneven surfaces, due to reduced proprioception, the body's ability to sense its position in space. The condition can also affect temperature sensation, making it dangerous to handle hot or cold objects. The neuropathy may be dose-related and can develop gradually over months or years of treatment. Some patients report improvement after discontinuing amlodipine, but recovery can be slow and incomplete. The exact mechanism by which amlodipine causes nerve damage is not fully understood, but it may involve interference with calcium channels in nerve cells, disrupting normal nerve function and leading to progressive degeneration. 5. Extrapyramidal symptoms. Extrapyramidal symptoms represent rare but serious neurological complications associated with amlodipine use, mimicking movement disorders typically seen with antipsychotic medications. These symptoms involve dysfunction of the extrapyramidal system, which controls involuntary motor functions and movement coordination. The condition can manifest as muscle stiffness, tremors, involuntary movements, and dystonia, significantly impacting patient mobility and quality of life. Dystonia, a key feature of extrapyramidal symptoms, involves sustained muscle contractions that cause twisting, repetitive movements, or abnormal postures. Patients may experience cervical dystonia, causing the neck to twist involuntarily, or limb dystonia, affecting arm or leg positioning. These movements are typically painful and can be socially embarrassing, leading to isolation and decreased quality of life. Other manifestations include body spasms, restlessness known as akathisia, and oculogeric crises, where the eyes roll upward involuntarily. Patients may also experience difficulty with voluntary movements, including problems with speech, swallowing, or walking. The tremors associated with extrapyramidal symptoms are typically resting tremors, meaning they occur when the affected body part is at rest. The exact mechanism by which amlodipine causes these symptoms is not fully understood, but may involve interference with dopamine pathways in the brain. These symptoms can be particularly distressing because they affect basic motor functions and can significantly impact a patient's ability to perform daily activities. Recognition is crucial because these symptoms may be mistaken for other neurological conditions, potentially leading to inappropriate treatment. 6. Severe cardiovascular effects. Paradoxically, amlodipine can cause worsening chest pain or even precipitate heart attacks in some patients, particularly during treatment initiation or dose increases. This phenomenon, known as coronary steal syndrome, occurs when the medication dilates healthy coronary arteries more than diseased ones, potentially reducing blood flow to areas of the heart already compromised by arterial narrowing. The result can be increased angina or even myocardial infarction in vulnerable patients. The drug can also cause severe hypotension, leading to dangerous drops in blood pressure that can result in fainting, falls, and injuries. When blood pressure drops too rapidly or too low, vital organs may not receive adequate blood flow, potentially leading to organ dysfunction. Patients may experience dizziness, lightheadedness, weakness, and in severe cases, loss of consciousness. Cardiac arrhythmias represent another serious cardiovascular complication, including both bradycardia, where the heart rate becomes dangerously slow, and tachycardia, where the heart rate becomes excessively fast. These rhythm disturbances can compromise cardiac output and may require immediate medical intervention. Some patients may experience palpitations, chest discomfort, or shortness of breath associated with these arrhythmias. The cardiovascular effects can be particularly dangerous in elderly patients or those with pre-existing heart conditions. Reflex tachycardia may occur as the body attempts to compensate for low blood pressure, potentially increasing cardiac workload and oxygen demand. Careful monitoring is essential, especially during the initial weeks of treatment when these effects are most likely to occur. 7. Taste disturbances, dysgeusia. Amlodipine can cause complete loss of taste sensation or severe alterations in taste perception, a condition known as dysgeusia. This rare but significant side effect can occur suddenly and may affect the anterior two-thirds of the tongue, where taste buds responsible for detecting sweet, salty, and umami flavors are located. The condition can range from partial taste loss to complete ageusia, where no taste sensations are perceived. The taste disturbances can manifest in various ways, including metallic taste, bitter taste, or complete absence of taste sensation. Some patients report that all foods taste the same or have an unpleasant flavor, making eating an unenjoyable experience. The condition can affect the ability to detect spoiled food, potentially leading to food poisoning or other health risks. The impact on quality of life and nutrition can be substantial, as patients may lose interest in eating due to the absence of taste pleasure. This can lead to weight loss, nutritional deficiencies, and social isolation as patients avoid meals and social eating situations. The psychological impact can be significant, as taste is closely linked to memory and emotional well-being. The mechanism by which amlodipine affects taste sensation is not fully understood, but may involve interference with calcium channels in taste receptor cells. 8. Gingival hyperplasia. Gingival hyperplasia represents a distinctive oral side effect of amlodipine, characterized by abnormal overgrowth of gum tissue that can cause both functional and cosmetic problems. This condition affects approximately 1.7 to 3.3% of patients taking amlodipine, with a notably higher prevalence among male patients. The overgrowth typically begins within the first 3 months of treatment and can progress significantly if left untreated, potentially covering portions of the teeth and interfering with normal oral function. The pathophysiology of amlodipine-induced gingival hyperplasia involves the medication's effects on calcium metabolism and collagen synthesis in gingival tissues. Calcium channel blockers can alter the normal balance between collagen production and breakdown in the gums, leading to excessive accumulation of fibrous tissue. This process is exacerbated by the presence of dental plaque and local irritation, which can trigger inflammatory responses that further stimulate tissue growth. The clinical presentation of gingival hyperplasia typically begins as subtle thickening of the gum tissue, particularly in areas between the teeth where plaque accumulation is common. As the condition progresses, the gums may become increasingly enlarged, taking on a firm, fibrous texture that differs from normal, healthy gingival tissue. The overgrown tissue may appear pale pink or reddish, depending on the degree of inflammation present. Functional complications of gingival hyperplasia include difficulty with oral hygiene maintenance, as the enlarged tissue can make effective brushing and flossing challenging. Patients may experience problems with chewing, speaking, or achieving proper dental alignment. The cosmetic impact can be significant, particularly when the overgrowth affects the front teeth, leading to social embarrassment and reduced quality of life. 9. Severe psychological effects. Many patients experience severe anxiety, depression, and mood changes while taking amlodipine, effects that can be debilitating and significantly impact daily functioning. These psychological effects can include panic attacks characterized by sudden onset of intense fear, rapid heartbeat, sweating, and feelings of impending doom. Some patients describe feeling like they are dying or experiencing overwhelming anxiety that seems to come from nowhere. The anxiety can be so severe that it interferes with work, relationships, and daily activities. Patients may develop agoraphobia, fear of leaving home or being in situations where escape might be difficult. Sleep disturbances are common, with patients experiencing insomnia, nightmares, or frequent awakening. The lack of quality sleep can exacerbate anxiety and depression, creating a vicious cycle. Depression associated with amlodipine use can manifest as persistent sadness, loss of interest in activities, feelings of worthlessness, and thoughts of self-harm. Patients may experience changes in appetite, either eating too much or too little, and may have difficulty concentrating or making decisions. The depression can be particularly challenging because it may not respond well to typical antidepressant treatments while the patient continues taking amlodipine. Mood swings and irritability are also common, with patients experiencing rapid changes between different emotional states. Family members may notice personality changes or increased aggression. The psychological effects can be so severe that they significantly impact relationships and social functioning. Recognition of these effects is crucial because they may be mistaken for primary psychiatric disorders rather than medication side effects. 10. Skin rash. Skin rash encompasses a broad spectrum of dermatological reactions associated with amlodipine use, ranging from mild, localized skin changes to severe, potentially life-threatening conditions. The most common manifestation is maculopapular rash, accounting for approximately 41.7% of all skin reactions, characterized by flat, red spots, macules, combined with raised bumps, papules, that may be itchy or tender. However, amlodipine can also trigger serious dermatological emergencies, including Stevens-Johnson syndrome and toxic epidermal necrolysis in rare instances. The pathophysiology of amlodipine-induced skin reactions involves complex immunological mechanisms that can include both immediate hypersensitivity reactions and delayed-type hypersensitivity responses. Type 1 reactions typically occur within minutes to hours of exposure and involve immunoglobulin E IgA antibodies, while type 4 reactions develop over days to weeks and involve T-cell-mediated immune responses. The specific mechanism varies depending on the individual patient's immune system and the type of skin reaction that develops. A maculopapular rash is a widespread symmetrical skin eruption, usually on the trunk, arms, and legs. It starts as flat red spots that become raised bumps, often with itching or burning. Some may also develop a petechial rash, small red or purple spots from minor bleeding under the skin. Severe skin reactions like Stevens-Johnson syndrome are medical emergencies. Amlodipine should be stopped immediately, and specialized treatment is needed to prevent serious complications such as infections, fluid imbalance, and organ failure. Early recognition and prompt care are critical. 11. Flushing. Flushing represents a vasomotor side effect characterized by sudden episodes of warmth, redness, and skin color changes, particularly affecting the face, neck, and upper chest areas. This reaction occurs as a direct consequence of amlodipine's mechanism of action, which causes smooth muscle relaxation in blood vessel walls throughout the body. The resulting vasodilation increases blood flow to superficial skin layers, creating the characteristic warm red appearance that patients describe as flushing. Amlodipine blocks calcium channels in vascular smooth muscle, dilating peripheral vessels, especially in the face and neck, which increases blood flow and skin temperature, causing visible redness. Flushing episodes are unpredictable, lasting minutes to over an hour. They range from mild warmth and slight color changes to intense redness and heat, often with sweating or feeling overheated, even in cool settings. Flushing usually lessens over weeks as the body adjusts to the medication, but some people may still experience occasional episodes. While harmless, it can be embarrassing in social or professional settings. 12. Constipation. Constipation emerges as a significant gastrointestinal side effect of amlodipine, characterized by infrequent, difficult, or incomplete bowel movements that can cause considerable discomfort and health complications. This condition slows intestinal transit, leading to hard, dry stools that are difficult to pass. Studies show amlodipine alone increases constipation risk fourfold compared to combination therapy. Amlodipine can cause constipation by relaxing intestinal smooth muscles through calcium channel blockade. This slows gut movement, leading to more water absorption and harder stools. Amlodipine-related constipation may cause bloating, cramping, incomplete evacuation, and infrequent bowel movements, often with excessive straining and discomfort. Constipation severity ranges from mild to severe, with some cases needing medical treatment. Chronic constipation can cause hemorrhoids, fissures, impaction, and may increase urinary tract infection risk, especially in the elderly. Was this helpful? Give it a like, share it with someone who needs it, and subscribe for more health and